Welcome to the training for the client face sheet for Rising Hill Homes. Before we begin, I think starting with our mission is super important. So, Rising Hill Developmental Homes exist to empower individuals with developmental and behavioral needs to live with dignity, purpose, and joy. We are dedicated to creating a safe and nurturing environment where every person is valued, every strength is celebrated, and every challenge is met with compassion and expertise. Through individualized care, innovative behavioral support, and a commitment to community inclusion, we inspire growth, independence, and the fullest expression of each resident's potential. Okay, now let's begin. So, the top section of the face sheet, you see the name. So just as it is, Jennifer Smith, their date of birth, their social security number. Make sure you put their correct UCI number. Then here we're going to put their Medi-Cal information, their IEP or whatever insurance it is. You put that card number down and then their date of admission. The placing agency for all of the homes right now will be San Gabriel Pomona Regional Center. Whoever the service coordinator is, you put that information there. Typically, the service coordinator will change because now they're using a particular service coordinator that'll be over all the homes. But as they're placed, they all have their own coordinators that they currently have. And then once they're grouped in a home, the service coordinator will change. So the face sheet has to be constantly updated. And we want to constantly look at the face sheet. So if there's any information that we need to update, we can. The address, that's the address for San Gabe. And then you want to always put the name of the administrator, or if there's only a house manager at that time, you put that name and you put the number to the facility or my cell phone number, which is 562-508-2007. Okay, so for the primary physician, we're just using some local agencies as an example for this. So, say the primary physician is Dr. Betts, the name of his medical office will go here, the telephone number, the fax number, his address to the medical office, the pharmacy. Rising Hill, we use Austin Drugs. So, in this particular situation, it would be Austin Drugs. But this is an example of another pharmacy. The dentist, whichever dentist they're assigned with, you put the name of the dentist. If they have an actual doctor's name or dentist name, you put that information there, the telephone number, the fax number, the address. And if there's any other specialist, say there's a psychologist or there's a psychiatrist, there's a therapist, and we can add to this if we need to, because we want to make sure we have all the information. Because in the event the administrator's not there, the house manager's not there, all staff should be able to go to this face sheet and get information. And a lot of times, Regional Center will also call and ask for information. So this form should constantly stay updated. Now we're down to the diagnosis section, which will go over what their diagnosis is. So in this particular case, we're going to say the diagnosis is Down syndrome. So if the diagnosis is Down syndrome, the language spoken would be English. Like their marital status would be single, their legal status, they're a U.S. citizen, religious preference, any allergies, eye colors, height, and any identifying marks. This is an important piece because in the event, let's say one of our residents walked off, got lost, right? Or one of our residents was incarcerated, didn't come home, or they eloped and ran away. If we have an identifying mark, it's helpful to the police because when we talk about our notes, we'll go into a different section. But this information is helpful to the police to know, or just anyone if we're trying to find them or something's happening. And so this concludes the client face sheet. So it's very simple. You may want to watch this video a couple times and get a blank form and try filling it out on one of the residents in the facility that you work for. That way you have a full understanding of it and add it into your book. So that way you're able to use that as a guide anytime that you have to do it. Thank you for watching.